So, all right. So good morning, everyone. My name is Russ Regents, and I'm with Blue Wave Television. Today, I am honored to have with me Dr. Nikki Javitt. She is the clinical provider for the BiFAT Clinic here on Roatan, which her and her husband, Matt, own. Good morning, Nikki.
Hello. Thanks for having me.
This is great. I've been looking forward to our conversation. As I've told you and Matt before, I always learn something new when I talk to you, so I've been excited and looking forward to talking with you. So our group out there, who's listening, you've heard the terms Ozempic, you've heard Wegovy, Mounjaro, you've heard some of these names. And what people think of these names are weight loss. That's what they're marketed as in a lot of cases, but really what are those? So they are considered what are called GLP-1 peptides. So this morning, I've got Dr. Nikki Javitt with us, and we're going to kind of talk through some of the main questions that our listeners and people in general have about peptides, the effects, the warning signs, and kind of everything we need to know on a high level about that. If you do want to have conversations directly with Nikki, they are definitely private. I would highly encourage you to have a conversation, to have a dig in deeper and do a true deep dive to see where these can benefit you in your own fitness journey, weight loss journey, overall health journey. So, Nikki, let's jump in. GLP-1 peptides. How do they work in the body?
So GLP-1 is actually a hormone that we already have in our body. It's in our guts. And so GLP-1 peptides, or more commonly referred to as GLP-1 agonists, they mimic this hormone we already have. And what GLP-1 does is it regulates our appetite, and it also helps control our blood sugar. So in the context of someone who has type 2 diabetes, so when you're a type 2 diabetic, we have insulin, right? But our body just doesn't use the insulin properly. So that's when we become called sort of insulin resistance. And then in the context of weight loss, what happens is these GLP-1 medications will send signals to your brain, and then that signal tells your brain that you are full. It also slows down how fast food leaves your stomach. And so when food is in your stomach longer, you feel fuller longer. And so you tend to eat less food. And then the third way that they work is in response to eating food, what happens is everything we eat has some sort of carbohydrate or glucose in it. And if we have any extra glucose hanging around, what happens is we store that extra sugar or glucose as fat. And so these GLP-1 agonists or GLP-1 peptides will simply, when you eat food in response to the food and the overload of carbohydrates, it will send a signal to your pancreas to tell your pancreas to release that insulin to then get that blood sugar down. So then you no longer store it as excess fat. In the context of type 2 diabetes, same thing. So you have this insulin resistance sort of going on. And so when we use these GLP-1 agonists, happens is it sends that signal to your pancreas after you eat food to release that insulin to get that blood sugar down.
Great. So what I'm hearing you say is this is a common conversation. You're not really adding something new that's never been tested into your body. You're in essence working with the hormones already in your body, and for lack of a better term, turning them on when you're actually eating. Is that a good way to describe it?
Yeah, that's a really good way to think about it. It's also, I like to describe it as, so as we age, or if we have underlying health conditions, what happens is your levels of GLP-1 that you already have may get lower. So my GLP-1 may be higher than someone else's GLP-1. We all have it. And so when you give yourself exogenously this GLP-1 agonist or these medications like Ozempic and Wegovy, we're giving back to our bodies something that we already have, but we may not have enough.
Okay, so it's kind of when women age, they tend to go through what are called HRT. You've heard this terms, human
Correct.
replacement, human hormone replacement therapy.
Yeah.
I almost said testosterone. I'm like, wait a minute, that's for guys. But so we're not really adding anything new. We're just enhancing or turning on already what's going on. I think that's a key differentiator.
Exactly.
Okay. All right, so let's jump into the question I know that a lot of people have. I was telling you just a few minutes ago, a conversation I had 48 hours ago. What are the potential side effects? Now, you've heard anytime you see an ad, there is, 30 seconds of ad, 3.5 minutes of side effects.
Yeah.
What's the truth in all that? What are the things we need to be cautious of with GLP-1 peptides?
So, okay, based on how the medication works, so these GLP-1 agonists, like we said, they're going to slow down how fast food leaves your stomach. Because of this, when food sits in your stomach longer, we typically see stomach-related side effects. So it's because the food's in there longer, and it's because your body just truly isn't used to that yet. So when we have these stomach-related side effects, it's typically upset stomach, maybe nausea. Some people, if it gets bad enough, they do throw up. And then we have constipation and diarrhea. So the reason that constipation happens in this context is when we have that food in our stomach for a longer period of time, especially if we're not moving around or if we don't have enough water to drink, so we're dehydrated, that stool that sits in your stomach is becoming harder. And over time, that leads to constipation. So you're not going to the bathroom as much. So that's why it's really important when we put anyone on these types of medication, we really had that conversation with them about the importance of staying hydrated, especially living here in Roatan. It's a higher climate. Your daily requirements of water are going to be higher, especially if you work outside. So I always say, typically the rule is that if you take your body weight in pounds, so if you weigh 200 pounds, divide that in half. That is the ounces of water that you should be drinking per day. If you live in warmer climates, such as Roatan, it should be more. So you would drink 100 ounces a day if you were 200 pounds, which is about like 5 20-ounce bottles of water. And so if you're living here, you need much more. And that's really going to help prevent that constipation. As far as diarrhea goes, I think a big misconception of diarrhea is that it's diarrhea, right? It's actually a form of constipation. When we eat food, and we don't have enough water and we don't move around enough and that stool sits in there and then we become constipated, we still continue to eat, right? Unless we're doing something like intermittent fasting or just overall fasting. And that new food that we put in our body really has nowhere else to go. So it tries to go around that already sort of hardened, dried out stool. And then that's when we get diarrhea. So in actuality, constipation and diarrhea pretty much go hand in hand. That's why it's also really important to, like I said, move around so you're not just sitting there and having your food just sit there, especially when it's in your stomach longer, and drinking enough water so we pull more moisture into that stool, making it softer so you can actually use the bathroom normally. Other side effects too that are not stomach related that could potentially happen, I like to say these happen, but they're not because of the medication. They can be headache or being tired. And when you actually think about it, so if you're eating less, you're taking in less food, this is when we can become fatigued or when we can get a headache. So it's not necessarily the medication. Yes, you're taking this medication to lose weight. It's more so that you're changing your eating patterns now, and this could lead to a headache or could lead to being tired.
And what makes good sense? One thing I want to definitely augment here is hydration. The
Yeah.
conversations that you and I have had have been highly over hydration, and not only just pure water, but salt water or salt in the water. Now that salt is because people forget, as you sweat, you're also sweating out a lot of the salt that's in your body.
Yeah.
We're taught in the United States, don't use excessive salt. Salt's
Right.
bad for you. But there is a component of salt that you definitely need in your hydration, lack of a better term, hydration therapy or hydration process, right?
Right.
Yeah.
So no, you're correct. I was just agreeing with you. Sorry.
No, that's true.
No, it's really important when so I think we might want to back up a little bit. So another misconception about hydration is that it has to only come from water. So water, I guess, when we think about it, yes, that's our best option, right? It doesn't have added sugar. It doesn't have any of these added things that come along with soda. It doesn't have caffeine for people who can't have caffeine. Caffeine's not bad in large quantities. It can be, but water comes from food. Water comes from other drinks as well, right? So if we drink milk, if we drink tea, if we drink coffee, if we drink all these things, they do have water. So I like to focus on that as well because I have a lot of people that come in and say, I have a really hard time of staying hydrated. I just don't like drinking water. And so, yeah, although it may be the best form to drink, as far as staying hydrated, I should say cleanest form, there's other options that you can have. And as far as your comment about salt, 100%, that's true. So what I was taught when I was in school is you should not exceed more than, X amount of milligrams of sodium from your diet per day. And you should really look at those food nutrition labels, right? Because it is true. When we have too much sodium, especially if we're a person who has high blood pressure, we really do want to watch that. But I think what we tend to miss out on is what you had mentioned, is that we actually need salt from our diet or added to our water. There's nutritional things that you can buy. Like there's an LMNT product that we actually use, my husband and I, that essentially puts more salt into your water that you're drinking. So it's just a little packet, flavored citrus, berry, whatever. You add it to the bottle of water, and then that has excess salt in it, and that helps you actually stay hydrated. It's a really good point, especially living here. I can't tell you how many times. I mean, I'm constantly putting on Vaseline on my lips because I am dehydrated, despite the fact that I'm drinking water all day long. My body is telling me, look, your mouth is dry, your lips are dry, you need to drink more water. So it is really important to also think about sodium content in your food, or maybe adding it to the drinks that you're drinking to make it so you're more hydrated.
That's a great point. And I always thought when we moved here, we moved from Houston, Texas. So Houston, Texas is hot, it's humid, all of those things. And I didn't realize personally the difference between here and even Houston, Texas. Never mind North America or Canada. I work out. I like to be outside. I was doing a lot of work when we first moved here. And I think I've told you, I passed out one night at dinner.
Yeah.
And it was not because I was actually, and by the way, the clinic over there in Coconut Tree Plaza, they did a great job with me. I was able to just kind of walk my way over with some assistance, and they tested me, and I was dramatically low with sodium. And the doctor there was great. He had made the comment, because I do drink a lot of water, and I was always kind of taught as an athlete to replace water, but nobody ever talked to me about all the additional, salt or anything else. And they hit me with a saline IV, and my wife will tell you, it was 30 seconds with that IV, and I thought, oh, okay, I feel much better. Ooh, yeah. I mean, it was, but you don't think about that. And I kind of took it for granted, coming from Houston, which is hotter than blazes.
Yeah, for sure.
Oh, this is no big deal. It was a big deal. It really was. So
yeah.
All right. So let me ask you another question. We've talked about, kind of hydration, kind of the key things, some of the negatives of GLP-1s. People ask is, if I go on GLP-1, or if I start, utilizing this, I have to become a vegan, or I have to go through this really restrictive diet. Are there certain foods, anything to be cognizant of while you're taking medications like these?
Yeah, it's a really good question. I think that's honestly one of the most common questions that I get. So everyone's different, right? So I guess the rule that I try to follow is we're going to want to avoid foods that are naturally irritating to the stomach lining to begin with. And again, that can be different for everyone. I absolutely love spicy foods, but for someone else, spicy foods we know are irritating to that stomach lining. So you may find that when you're on these medications, when you eat spicy foods or really greasy foods or high fatty fried foods, things like that. And even for some people, like my husband, when he started taking the medication, he was eating steak and he was like, oh my gosh, my stomach hurts really bad right now. Like it just doesn't feel right. And, that makes sense when we actually think about how much longer it takes our body to break down or metabolize foods such as steak. So because the medication is keeping that food in your stomach longer, and now you're eating something that takes a longer time to metabolize, you may get bloating and upset stomach and feel uncomfortable. So I really feel like over time, people truly learn just by trial and error of what is either going to affect them or not. I have people that come into me and tell me, oh my gosh, when I drink carbonated beverages, I just get bad acid reflux or my stomach feels bloated and upset. And it makes sense, right? When we know how the medication works, if that food is in your stomach longer, drinks are in your stomach longer. So carbonated beverages, the gas has nowhere else to go except for maybe up and out. So you might burp more, you might have acid reflux, and then alcohol too. Now, it's not that you can't drink alcohol or wine, spirits when you're on these medications, but you may realize that because alcohol is naturally irritating to the stomach lining, that when you are drinking alcohol, you may get an upset stomach. So I really think that it just truly is like trial and error when you start these medications to figure out what may affect you and cause these side effects, these stomach-related side effects that we just talked about, to either be more or worse. And maybe it won't affect you at all, but it really, truly is just kind of trying out the different foods. But in general, just avoid things that naturally irritate your stomach already, especially if you know it.
Well, and that, you bring up a good point, because as I was listening, the first thing I thought was, oh no, I have to become a vegan and I don't get to have any salva vita. This is a problem. No, but
No.
we joke, we joke, but in all seriousness, I think that really augments the point of if you are heading down this healthier eating path, it's important that you engage with Dr. Nikki and make sure that you're having these conversations. Because again, her experience has been really pretty extensive, and she's, for lack of a better phrase, been there, done that. So she can take and really have that conversation, but it's really important to have that conversation open and honestly, with your provider. So.
And I do, like, to your point, Russ, I really feel like this is a learning experience for me as well. Like the whole carbonation in the beverage thing, I wasn't even aware of that, right? So most people don't think when they drink a soda or they drink a sparkling water or a can of beer that that's going to upset their stomach. But when you think about how the medication works, it starts to make sense, especially when I get this feedback from my patients. I do want to bring up something else too, just because we're talking about food in general on things to avoid. And your whole point of not wanting to be a vegan or a vegetarian on this medication, it's really important too that while you're on medications like this, that you focus on protein. So there's several reasons why. So first and foremost, protein is going to fill us up and it's going to make, I guess I should say a better way to say it is protein fills us up and keeps us fuller longer, if that makes sense. So if you start your meal with a protein, and then even if you want the piece of cake at the end, that's fine. But if you start your meal with the protein, hopefully what you hope is that you feel fuller longer so you eat less over time, right? It also helps if you start your day with protein. So if you start your breakfast, or maybe you don't eat breakfast, you go straight to lunch and you're eating at noon, you start that with protein, then that will carry you throughout the day to hopefully prevent you from snacking in between. Another reason why protein is so important, and I think a lot of people tend to not talk about this, but is because, okay, our muscles are basically our powerhouse or what helps keep our metabolism up. And when we lose weight, we lose fat, but we also lose muscle. So what ends up happening is in the long run, if we don't consume enough protein to sort of keep that lean muscle mass on, we can do ourselves a huge detriment in the long run. Because when your body, let's say you start out at 200 pounds and you lose 30 pounds and now you're 170 pounds, which is great, right? But if you haven't eaten enough protein and you've lost muscle and you've lost fat along the way, what you end up doing is you slow your metabolism down. Now, your metabolism is already going to be slower because you lost weight. Your 200-pound body required a different sort of energy intake or calorie intake to keep you at your current metabolism. And now your 170-pound body weight, you require less energy in. So that coupled with losing lean muscle mass means that your metabolism is even slower. And so when you try to get off medications like GLP-1 medications, or maybe go to a maintenance dose, or try to just resume some sort of normal eating where you go back to maybe having that indulgent snack a couple times a week, that's when we sort of hit these weight loss plateaus, or when we sort of hit these situations where people who are on these GLP-1 medications have difficulty kind of keeping that or sustaining that weight loss, because it's so hard now with your slower metabolism. If you've lost that lean muscle mass and you now have a slower metabolism, to maintain any sort of normal eating habits, for the rest of your life. So it's super important to focus on protein, whether you are a vegan or a vegetarian or you eat meat. And the general rule for that is to try to aim for, and it is very difficult, but it's to try to aim for, while you're on these medications, about 0.8 to 1 gram per pound of body weight in a day, which is a lot. But if you try to err towards the higher side, that will really help you so you don't lose that lean muscle mass and you keep your metabolism so it's at a normal state, if that makes sense.
Absolutely. So let me ask you kind of a follow-up. Is it advisable to stay in, because one of the things we've heard about is the importance as we get older of having muscle mass, of having strength still, even into our 70s and 80s. Is it advisable while you are on this weight loss path or on this adjustment path to continue some light weight work to kind of help that muscle mass?
Yeah. So interestingly enough, like if you actually read about these medications, so the package insert of all of these GLP-1 agonists will tell you that these GLP agonists can be used for type 2 diabetes and for weight loss, but they work best, I should say, with lifestyle modifications. So that would include nutrition and definitely physical activity, We also get into things like stress management and good quality sleep, because that's really going to help you, because those are some other things that really contribute to weight gain. And we can talk about that later. But in the context of continuing, I guess, lifting weights, I always say it's best to think about, to maintain that lean muscle mass, you want to think about resistance training, whether that's through lifting weights and you already do that, that's great. But to start taking a GLP-1 medication, start lifting weights, start doing all these changes, it's often difficult, and people typically end up hurting themselves. So you can incorporate resistance training to help maintain that lean muscle or build lean muscle. You can do that by simple exercises in your home. That's another thing that I think a lot of people have difficulties with, whether it's a financial decision on having to pay for a gym membership, whether it's going into a gym and just getting the motivation to leave your home. You can do these resistance training type workouts at your house without ever even using weights. So things like wall squats, sitting against a wall until, the tops of your thighs are burning, maybe wall push-ups, using your own body weight up against a wall. You can do chair dips. That will really help maintain that lean muscle mass, in addition to making sure that you focus on consuming enough protein so that you don't get in that weird situation where your metabolism is completely slowed down.
That's a great point. And you referenced something that when you and I first started having these conversations a couple of years ago, one of the things that you would reference, and I'll bring up to everybody, is rest.
Yes.
Stress management and rest. When my wife and I moved here, we were both retired early. We were corporate executives. If I had 6 hours, I don't think I slept for more than 6 hours, even on the weekends, for almost 30 years.
Yeah.
Once we got here, we're both sleeping 8 to 9 hours regularly.
Which is
And
great.
we feel better. It really is. And I always, in my world, it was called kind of a badge of weakness. Oh, you have to sleep. What's the matter? You can't do all this stuff in a day. No. But when you stop and really think about what you're trying to get done, and you're trying to maximize your body's arguably the greatest machine ever, that performance, well, you have to take time to let it shut down at times. You have to rest. And if you don't, your body's going to tell you, hey, I need to rest. And you get sick, or you pull a muscle or something like that. But your body, your body will talk to you. So
yeah, it really does. And in the context of weight loss, so when we are sleep deprived and we don't get enough sleep, it really affects our hormone levels. And there's two hormones. There's one called ghrelin and another called leptin. And ghrelin, I always think of like, growl, I'm really hungry. When your ghrelin levels are increased, that means that you're going to be hungrier. And that happens when you don't get enough sleep. And then leptin is the opposite. So it suppresses your appetite. And so when we don't get enough sleep, our leptin levels are too low. And so when we actually get good quality sleep, and getting sleep is great, but is it good quality sleep, right? So good quality sleep is technically getting the right amount of sleep, but sleeping throughout the night. Now, getting up maybe a couple times during the night to go to the bathroom, and then being able to fall asleep within, 5 to 10 minutes, that's good quality sleep. It's when we get into those issues where you're waking up and then you're unable to get back to sleep. It's taking a half an hour, maybe a couple hours to get back to sleep. You're scrolling on your phone, you're having racing thoughts, things like that. That is interrupted sleep, and that can really affect those leptin and those ghrelin levels. And that's why we hold on to that excess weight. So it's truly, truly important. That, in addition to stress management, right? So when we're stressed, in the short term, our cortisol levels go up. But chronic stress over time, what ends up happening is when your cortisol levels are too high, you hold on to that excess weight. And so there are things, and these are not things that you can fix overnight, right? Like automatically I'm going to start sleeping better, or I'm just not going to be stressed anymore. I mean, there are people that go through some pretty stressful life events, and it's not just a quick fix overnight, right? But there are things that we can do to help sort of get you on the right path to either sleeping better or to managing your stress better. So simple things, just like for stress, for example, simple things like maybe listening to music, trying to take time for yourself throughout your workday. So I'm the one that is like, I have something to do. I have to do it now. I'm sitting at my computer. I'm not even getting up to go to the bathroom. And so I make it just myself a priority, saying I'm going to get up once every, in an hour. I'm going to get up for 15 minutes. I'm going to walk around. I'm going to use the restroom if I have to. And I'm really going to kind of decompress. I'm going to not think about work. I'm not going to answer emails, and taking that time for myself. Or maybe I am stressed. So I say to myself, well, what makes me not stressed? Listening to music, working out, calling one of my sisters, just to talk about nothing that's stressing me out, but just so I can kind of get away from that stress to make it so my body isn't always in that heightened state or those increased levels of cortisol. And then for sleep is a little bit different. So I think for everyone, especially if you have like a husband or significant other, someone's sleeping patterns may be affecting you. Does your significant other snore? Do they watch TV before they go to bed? And those are very, very hard habits to break, especially if the other party isn't willing to do so. But things that you can try to do for yourself is, especially living here in Roatan, is making sure that the room that you're sleeping in is cool enough so you're not uncomfortable and waking up because your body temperature is too hot, not scrolling on your phone before you go to bed, getting that sort of blue light in your eyes, or maybe reading a book to try to calm yourself before you go to bed. Just simple things like that. Maybe listening to something in an earbud so your partner can't hear it, just some soothing spa music. But there's certain things that you can do to eventually work your way towards better, good quality sleep and better stress management, so to speak. But they're not easy fixes overnight, but just to be aware of them and to be aware that those things actually do affect your weight and your health overall. It's just really important to know those things.
Well, and you nailed it on the head. I think what I keep hearing is lifestyle change. When you're
Yes.
ready to commit to that lifestyle change, it's not just take a shot, take a pill, come back in a month. It is focusing on being mindful, for lack of a better term, about what's going in, what's happening in your body, and being cognizant of it. So, yeah, good. So quick question. Okay. So GLP peptides for weight loss, how do these differ than like traditional medications used for weight loss? We talked about it being a hormone. What are some of the differences?
I actually get asked that a lot. So the way the GLP medications differ from traditional weight loss medications is one, how they work, and two, the possible side effects. So, okay, I'll go over there's so many different weight loss medications. So a couple of the more popular traditional weight loss medications would be phentermine, or it's known as Adipex or Adipex P. And then there's Orlistat, or it's known as Zenecal. So phentermine actually is a stimulant, and it actually mimics the amphetamine. So what happens when you take stimulant medications, the theory behind the weight loss on that is it increases your metabolism so you lose weight. But because of the way the medication works in your body, you get all of these unwanted side effects. So that would be things like dry mouth, irritability, nervousness, increased heart rate, trouble sleeping. And so because those types of medications are associated with those side effects, phentermine typically is not prescribed for more than 3 months at a time. It's just not safe, and it really hasn't been studied for long-term use, right? And then medications like Orlistat or Zenecal, they work differently from phentermine. So they work by inhibiting your body to absorb fat from certain foods. So if I eat a piece of fried chicken or I eat something that's super fatty, when you take the Orlistat, it inhibits some of the fat in that food from being absorbed. So how do you lose weight from that? So you poop it out. So because of that, what ends up happening is you get just stomach-related side effects like oily stools or upset stomach, you get diarrhea. And a lot of times it's difficult when people start taking these medications to actually continue on with what I would call a normal quality or good quality of life, right? If you're always sitting on the toilet because you're pooping out your food, because you're not absorbing all of the fat from the food, it's not really sustainable, right? They work differently. GLP-1 medications, we know, do not work like that. GLP-1 medications send signals to our brain to tell us we're full, keep food in our stomach longer so we're fuller longer. And then when we eat food, in response to the sugar from our food, we release that insulin from our pancreas, which lowers our blood sugar. So we don't store that excess sugar as fat. So they work differently. And again, side effects, like we mentioned, you don't get those stomach-related side effects with GLP-1, but you do get some, like the upset stomach, maybe nausea, constipation, or diarrhea, like we talked about. I will say this, that unlike the traditional weight loss medications, GLP-1 medications in clinical studies, have been proven to actually lower your blood pressure, lower your cholesterol, and decrease your overall risk for cardiovascular events by 20%. And by cardiovascular events, we mean specifically heart attack, stroke, and death from heart attack. So traditional weight loss medications do not do this. So I guess long-winded. They just work differently, and then you have a different side effect profile with the traditional medications.
Well, and I think that makes sense. And that kind of dovetails into, my next question for you is going to be, when people first heard about this, they heard Ozempic, usually like we were talking about on the ads. I'm lowering my A1C. But then it said all of a sudden it became popular as a weight loss opportunity, as a weight loss drug. You just referenced some of the more recent studies and the research that's coming out and saying, hey, it actually helps on the cardiovascular system. It helps prevent some of these. So kind of what do you read? I know you're always reading. You're always doing research and reading. What are you seeing as far as, emerging research on GLP agonists? Am I saying that right?
Yeah, GLP.
Okay.
So it is technically a peptide, which is just a string of amino acids. When you have a really long string of amino acids, that's a protein, but shorter strings of amino acids like lysine, glucine, arginine, all those things, that's when it is a peptide. So people refer to them as GLP-1 peptides. People refer to them in the healthcare or pharmaceutical world, it's a GLP-1 agonist because it acts on a certain receptor in your body. That's just what the word agonist means. So, or you might just hear them being referred to as GLP-1s. So it's all the same thing. You'll just hear the terminology being used differently.
See, I always get smarter when I talk to you, Nikki. And I am going to start using agonist because it makes me sound cool. So,
okay. Yeah.
Dr. Nikki told me I can say it. So what are you seeing research-wide out there as far as some of the future uses? More research is coming in. What are you reading kind of going forward?
So I could probably talk about this all day, but we don't have time. But there are so many clinical studies that have been published or ongoing studies right now in phase 2 and phase 3 trials that look at GLP-1 and its potential to help just a plethora of disease states, right? So some of the ones that really interest me is neurodegenerative diseases like Alzheimer's and Parkinson's disease. Research that has come out on this essentially says that GLP-1s are decreasing that neuroinflammation or the inflammation in the brain, therefore helping with cognitive function in people who have Parkinson's and Alzheimer's. The other studies that I really like to look at are PCOS, or polycystic ovary syndrome. I have a lot of women that come to me that have this underlying health condition. And polycystic ovary syndrome is essentially like type 2 diabetes in the fact that these women are insulin resistant. And because they're insulin resistant, it messes with some of their hormones and it causes unwanted facial hair growth around the jawline or on the chest. It also affects fertility and menstrual cycles. And so they're studying GLP-1 agonists in the context of polycystic ovary syndrome, in the fact that it basically does kind of what we talked about before. It increases insulin sensitivity, like we use them for type 2 diabetes. And when you increase that insulin sensitivity in women who have polycystic ovary syndrome, we are now seeing these women have hormonal imbalance become now regulated. And because of that, their menstrual cycle is becoming more regulated. And then they're now able to get pregnant and they're getting rid of these fertility issues, which is super important, right? And they're also losing weight because when you do have PCOS, you have that excess added weight because of sort of the dysfunction that you have with your metabolic system. Other things are post heart attack, so post MI. What they find is that, and these clinical studies find that the GLP-1 agonists, when you give it to a person who's had a heart attack, when we have a heart attack, we have ischemia happen or sort of like a decreased blood flow to a certain area of our heart. And when you give a person a GLP-1 agonist, it increases angiogenesis, which is the formation of new blood vessels. And when we do that, the heart becomes more perfused. And so it's repairing that damaged heart tissue, which is amazing, right? And there's really no medications. I mean, there's medications you can take to prevent clots or maybe bust up a clot, but to really reperfuse that heart tissue and the damaged heart tissue and then make it better is phenomenal, right? So I look at studies like that because when you think about it, I'm sure that a lot of people know women with PCOS. A lot of people know people who've had a heart attack. You may know people, unfortunately, who have neurodegenerative diseases. They're also even looking at these type of medications for sleep apnea, which is important because in the context of weight management, a lot of people who have obesity or who are overweight have sleep apnea. And this is because when you think about it, you have the excess net fat around this area that is affecting the airway. And so when you give people GLP-1s and they lose that weight, and they lose that excess net fat, then you're helping with their sleep apnea, which is great, right? Because it all kind of goes hand in hand. What we talked about, you want good quality sleep. So if you have sleep apnea, even when you're using a CPAP machine and you're not breathing like you should, I mean, that's affecting your sleep and it's affecting your weight. Yeah, there's so many clinical studies that are out there that are really promising and really exciting, but there's just too many to go over all of them. But some of those are the ones that I try to focus on because I do see a lot of people coming to me with those various issues.
I think that's brilliant. I love hearing that. And I think personally, as you were mentioning those different ways that the research is being utilized, I was just kind of clicking off in my head, and many members of my family, direct family members, have sleep apnea. A niece went through PCOS and got it all worked out, and now she's a mother to an incredible little baby boy.
That's
You
awesome.
start seeing these things, right? I mean, it's just all the way that these types of knowledge and especially, addressing hormonal issues can dovetail into a truly better quality of life, non-surgical, non having to take opioids, not having to do some of these different things, sleeping pills. When you can let your body truly work for you and just give it the fuel that it needs and the attention, so much better than getting cut open, getting stitches and all the rest, and getting on the drugs, getting on the Xanax and all the other things. But if you can really start to strip away a lot of that and let your body work for you, it just seems to me like it's an overall better, healthier life. And I can attest it is. Since I've retired, things have gotten so much better. I'm fitter, I'm sleeping better. My relationship with my wife's gotten better because I'm not angry all the time because I'm sleeping. I'm not pissed. I don't get angry anymore.
Your stress is less now.
It really is. And I don't know. Again, I learn something every time I get a chance to talk to you, Dr. Nikki, just because I find this area of research so incredibly impactful to every person's life. So, all right. So for the sake of time, I've got one more question for you. So, and again, thank you very much. I really appreciate you taking the time and really opening up and diving deeper on a lot of these, because again, we hear certain things from the media, and until you really get a chance to talk to a true medical professional like yourself to see the long-term just impact, not just, hey, I'm going to lose a couple pounds, but what can I do for my body so I am healthy at 60, 70, 80? So my last question is this. Ideal candidates for GLP-1 peptide therapy, kind of what are the starting steps? So do this. Who's a good candidate? Obviously somebody with diabetes. And then kind of what's the next step from there, if you don't mind, please?
Yeah, so I think for GLP-1s, if you have type 2 diabetes and let's say that you're on metformin or you're on some sort of oral agent for type 2 diabetes and you don't have the blood sugar control that you'd like to see, or maybe you're not within goal for your A1C, which is your 3-month average of your blood glucose, these are definitely a class of medication that you can consider talking to your physician about to maybe help better manage your blood sugar. And then when it comes to weight, I would say that candidates who want to take GLP-1s that just come to me and say, I have 5 to 10 pounds to lose. Listen, I get that. A lot of us have that even when we get older, our hormones change, we have that excess belly or that visceral fat. But these medications, it's not that you shouldn't be a candidate for that. You can take them. But I think a better candidate would be someone who has tried everything already, like lifestyle modifications that we discussed. So diet, exercise, and actually, I don't like saying the word diet, so I'd say proper nutrition. So proper nutrition, lifestyle changes, such as sleep management, stress management. And then despite all of those changes that they've tried to make, if still then they're not able to lose weight and they come to me, I would say that's the ideal candidate because you already have someone that's on the path that's willing to make these lifestyle changes. They just kind of need a little bit of extra help. And maybe that GLP-1 treatment can help them, give them that boost to help them, whether it's maybe they emotional eat and they need help with turning off food noise, or maybe they just have some sort of metabolic dysfunction going on. They're not type 2. They don't have PCOS. They don't have something wrong with their thyroid. They just have some sort of underlying metabolic dysfunction. And so you give yourself that GLP-1 medication And then when you eat, we get those blood sugars, instead of spiking up and down all day long, we sort of get you at that steady state. So those would be the ideal candidates for it. I would say we should probably also talk about people who shouldn't take the medication.
Yeah, please.
Yeah. So if you have a personal history of thyroid cancer, or you've had a first-degree family relative that's had thyroid cancer, meaning a parent, a sibling, or a child that you've had, you should not take GLP-1s. And I like to kind of explain the reasoning behind it because it sounds super scary. Before medications in the United States are approved for use in humans, they are studied in animal models. And when the first GLP-1 medication came out, which was Byetta, back in 2005, so a long time ago, these medicines were studied in rodents or rats. And when they gave them to rats, some rats developed a thyroid nodule, which could potentially later turn into thyroid cancer. So the FDA comes in and says, okay, listen, we do not want this risk to translate to humans. So we're just going to put a warning on the medication that if you have personal history, meaning you've had thyroid cancer, even if you've had your thyroid removed, because when we remove our thyroid, we can't really ensure that every single cancer cell is removed, right? So if you've had your thyroid removed, you've had thyroid cancer, or you've been treated with chemo and radiation and you still have your thyroid, or that first-degree family relative, we don't want to risk that potentially happening. So we'll just say we'll screen you for that. And if that pertains to you, you shouldn't take it. So that's one reason you shouldn't take it. If you're pregnant or breastfeeding, you should not take it. I always ask women, and it is an uncomfortable conversation, regardless of your age, like, do you plan on becoming pregnant within the next couple of months? If so, you shouldn't take these medications. The reasoning behind that is simply that these medications last a long time in your body. The half-life of these GLP-1s are anywhere from 5 to 7 days, with small trace amounts lasting in your body for up to 7 weeks in the case of semaglutide. So if you're trying to become pregnant, you don't want that medication in your body when you're trying to become pregnant, right? And obviously a woman who is pregnant taking these medications, we don't want that. Like, we're growing a baby, we're feeding life, we're trying to give this, baby nutrients from our body. We're not trying to lose weight on a GLP-1. So you can take it afterwards if needed. Other instances would be, so we didn't go over this in the side effects. I kind of just went over common side effects, but there is a risk with the medication of getting pancreatitis or gallstone. And it's not the medications themselves causing these two things. It's when we lose weight fast, we're dehydrated and we don't move around. It's sort of the perfect storm for those things to happen, right? So we have our gallbladder, which has our bile acid in it, which is a liquid. And when we eat food that has fat in it, that liquid sort of emulsifies or helps us break down those fats. And when we lose weight and we're dehydrated and don't move around, that bile acid can then turn to sort of like a sludge and eventually stones. And it's really painful. And because your pancreas is located in such close proximity to your gallbladder, what ends up happening when you get those gallstones is that it could inflame your pancreas and cause pancreatitis. So we always say that if you have active gallbladder disease, so if you currently have gallstones, you're not going to want to take this medication, right? We're going to want to wait till you don't have gallstones, or maybe you eventually get your gallbladder removed to put you on a GLP-1 agonist. And then these medications just simply have not been studied in people who have ever had pancreatitis. So we don't want to risk that. So those would be a couple other people who shouldn't take the medication. And then the last one is if you've had a recent heart attack within 6 months. And it's not because you can't take these if you've had a heart attack. It's the logic or the reasoning behind kind of what we talked about. These medications work best when we work out, right? We have some sort of physical activity. And if you've recently had a heart attack, you're put on restrictions, right? You're taking all these different new medications and you're not supposed to be as physically active, right? So we wouldn't want to give you a GLP-1 medication for weight loss, even if you needed to lose weight, if you had a recent heart attack because you're on some sort of physical fitness or physical activity restriction, and we want you to be able to work out while you're on these medications. So those are the people who should avoid these medications in the meantime or until their situation changes.
Sure. No, well, that makes perfect sense. I mean, and that's where, again, knowledge is power. That's where you want to make sure that you're having these discussions prior to it with your primary care physician, and then obviously with a true qualified professional like Dr. Nikki. It's important to have these conversations up front so that you don't end up in problems heading down the road. The thyroid thing I thought was very surprising. You had told me that a couple of weeks ago when we had that conversation. I thought that was interesting because, it's not something that you would think has a direct impact,
Yeah.
but because we're talking about usually a gastro type issue, but no, that makes perfect sense. So beautiful. Dr. Nikki, thank you so much.
Thank you
I
for
just want to
having me.
say this has been great. As I tell you, every time I get a chance to talk to you, I always learn something new. And it does two things for myself and for my family. We are trying to make these changes. We are heading down that healthier lifestyle path. For almost 30 years, we lived that high speed, high executive corporate type life. And it did well for us in certain respects, and it was really bad in others. And for us personally, it's always good to kind of head down this path and have friends and access to true clinical professionals like yourself to bounce things off and to really just listen to. And it's incredible. And I know that there's a lot of people on this island who either are truly diabetic or pre-diabetic, and they're always looking for ways to enhance their life. I mean, that's a big reason most of us live here, is we want to leave behind a lot of wherever we came from, leave the bad things, bring the good, and restart the good. And it's just great to talk to you every time. So for everybody who's listening, this is Dr. Nikki Javitt. She's a clinical professional with the BiFAT Center located here on Roatan. And we've had a great opportunity. My name is Russ Regents, and I'm with Blue Wave Radio, Blue Wave Television. And we've had a great time talking to Nikki. So until we see you next time, thanks you so much, Nikki. Take care of you.
Thank you.
Take care.